Good afternoon, everybody, and thank you for joining us today. I'm going to give folks just another minute or two to hop on, and then we will get started. April is about to log on, so I'll go ahead and get started. Thank you guys so much for your patience, and I apologize for the wait. But thank you all for joining us today for our virtual Tour Tuesday. My name is Jamie Roy, and I'm a senior manager with United Way's Workplace Engagement Team. And I have the pleasure of working on our Tour Tuesday series. So Tour Tuesday is an opportunity for folks to get an inside look at the great work happening in our community through United Way's partner agencies. For fellow nonprofit staff, this is a great way to learn about other service providers and programs that might be beneficial to your own clients. For those looking to get involved, it can be a great way to hear about current volunteer engagement opportunities. And for our United Way donors, this is a fantastic opportunity to hear from the agencies directly who are putting your dollars to work in our community. While we do hope one day our Tour Tuesday series is back in person, we are happy to continue with these virtual tours. Each tour features agencies from across the greater Nashville region as we come together to discuss today's community conditions. During today's tour, we'll be discussing how we're building strong, healthy communities by providing recovery services for women. We have the privilege of being joined by April Barnes, Director of Outreach and Development with our partner agency, The Next Door. Let's see, I think April is still having some issues. There she is. Yay! Thank you, April. April, can you hear me?
Hi, can you hear me?
Yes, thank you so much for joining us.
Oh.
Get that pulled up. Do you want to go ahead and introduce yourself and tell us how long you've been at The Next Door?
Yes, so my name is April Barnes. I am the Director of Outreach and Business Development at The Next Door. And I actually started at The Next Door about 5.5 years ago as a detox nurse. I'm an RN, so my background is registered nursing. And throughout my time here, I've moved from my role as a detox nurse to a clinic nurse, admissions nurse, kind of worked in a lot of medical roles. And now my role in the community is to work with partners to try to help women gain access to treatment in the ERs and social service settings, things like that. Just really trying to spread the word about what we do. So, yeah.
Awesome. Well, while I am waiting for that PowerPoint to come through, why don't you go ahead and just tell us about The Next Door? What's your mission? What do you guys do?
Yeah, I just sent the PowerPoint, so it should be in your inbox, hopefully, any second. So really, The Next Door, I work for The Next Door, which is the program here in Nashville, but we have another location that's in Chattanooga as well. So I'll start with talking about just some history of The Next Door. And we started as a re-entry program for women that were leaving incarceration and needed a place to go upon release from prison. So, over 15 years ago when we started serving women, it was in that capacity. It was the Next Door, their next step upon leaving the women's prison here in Nashville. And the reason that a few years ago we shifted our services here in Nashville is to help with the opioid crisis and the epidemic around people overdosing. And so now what we do in Nashville is more acute services for women that are struggling actively using substances. So but yeah, our mission and purpose is to empower women for lifetime recovery. We were founded in 2004 on Christ-centered compassionate care. And what that looks like for us is that we walk alongside women early in their recovery journey, just with love and compassion, the way that Jesus responded to people that were in need. We're a nonprofit ministry. And again, our programs has grown throughout the year. We still or throughout the years, we still do have our program in Chattanooga that has the reentry model. And so those women that are leaving incarceration, they go into that program, and that's a longer term program, which was what the Next Door originally was, the way that the program was designed. And we can go to the next slide now. So again, we offer a full continuum of care, and our mission at the Next Door is to provide that full continuum of care with evidence-based substance abuse and mental health services for women in an environment of faith and healing. Again, that just goes back to that Christ-centered compassionate care to equip them for lifetime recovery. And yeah, because we are founded on, faith and the love of Christ, we have really built our core values around that and our belief systems. Here are some of our core values that are listed here. And I won't read the whole explanation, but it's very important for our staff to model and to show love and faith, hope, wholeness, community, respect, and encouragement. That's really the pillars of how we build all of our program models and how we live out our day-to-day interactions with the women that we're serving. So here in Nashville, we do have a medical model approach. And so what that looks like is women that are in a more acute addiction crisis, needing anything from inpatient medically monitored detox to outpatient programming. We offer that at our Nashville facility. So say that you have a loved one or a friend, or are personally struggling and using substances every day that would require 24/7 medical monitoring. We have that medical model so that we could provide a detox process that is safe. We also offer that for pregnant women up to 38 weeks in gestation. And we've seen that that's been a huge resource to the community. There are not a lot of options for women that are pregnant that are actively using substances with the full continuum model that we offer. So any female that is struggling with actively using substances every day and may need that medically monitored detox, that more acute intensive level of care, we do have that as an entry point. We sometimes also have women that come in and maybe they're not using every day, or maybe they are and they don't require 24/7 detox monitoring that can admit into our residential programming. During that residential programming, the client will have a case manager and a therapist that has been assigned to them that works with them so that they can build an aftercare plan. Because if we only have, say that we have a client with us for 21 days, which is just a few weeks, sometimes there are a lot of needs. And so that's definitely something that we try to work on upon admission. I just had a question pop up, and yes, we are able to help uninsured women. We have a specific grant for pregnant women, and we also have some grant funding for people that do not have any insurance or any resources, and that comes through the state, through the Tennessee Department of Mental Health and Substance Abuse Services. So there are some requirements and some guidelines around that. But yes, we are able to help. Really, our program, all levels of care, we can help women from uninsured to in-network benefits with a lot of the major commercial payers like Blue Cross Blue Shield, Aetna, there's, all of the 10 care providers, so AmeriGroup, United Healthcare, and, even some of the Medicare dual policies, some of the TRICARE policies. So really, I like to think that because we're able to help women with no ability to pay to in-network commercial benefits, pregnant, not pregnant, mental health needed, there are so many ways that we can help the community that we're really a great option for women in the community, that no matter what their needs are, just because we have that full continuum model. Let's see. So we also have outpatient programs. So what outpatient looks like is it's structured daytime programming. It either runs for the PHP model, that's going to be 5 days a week, or 5 to 6 hours a day. And we have our outpatient programming, which is IOP, which we do have several sessions available for that. We have learned that 9 to 12 may work for some clients. Afternoon programming may work for some clients. So we have some different options there as well. An outpatient is a good program for those that are struggling and just need more support than, say, 12-step meetings or outside recovery support services, so that they can still come and have the benefits of clinical programming and a case manager and a therapist, but it doesn't require them to be living on site, or, they're still able to work in that program as well. We have our aftercare program, and what that looks like. Basically, since one of our core values is community, we really empower and encourage community even after you leave the next door. So that support of recovering together with other women and being a part of the alumni program, which is, if you've been through any level of care, any of our programs, you're part of this T&D sisterhood, for life. So really, aftercare is available to you, and that meets every Wednesday night. We have groups that meet off-site to do fun, sober, activities. So, there's an app that you can engage in so that you can stay connected to other women that are in recovery as well. So it's really, it's all about that core value of community and recovering together so that you have support. And then we have our Freedom Recovery community that is located right across the street from the building that's pictured here, which is where our inpatient services are. And that is 21 apartments where women live with their children, and it's females only except for the children. And then, as I mentioned earlier, we still have our reentry model, which is a program at our Chattanooga location. All right, so here's just a quick screenshot of what some of the buildings or what some of the areas look like. Where it says entrance, that is our Nashville location, where our detox level of care, residential, our outpatient levels of care, everything is within that building. And then you can see, as you go to the right, our reception or front door entrance, our chapel. We have detox, residential, and residential community room spaces. And then we also have our outpatient group rooms. That's just one example of what one of the outpatient rooms looks like. And then the 21 apartments that are over at the Freedom Recovery community, they are listed right there in the top left. That's top left corner there, that photo. So as I mentioned, we do have 24/7 nursing and medical staff on site. So for any client that is coming into an inpatient level of care, they will have an admission nursing assessment, which essentially triages the medical and psychiatric needs of the client to make sure that we can provide the level of care that they need. Within 24 to 48 hours, they are also going to meet with a psychiatric provider and a family nurse practitioner or a medical provider to have a psychiatric evaluation and a full history and physical. And then we also, we have some collaborative partnerships with some of the other organizations to do STI training, specifically for HIV and some other things as well. And then in terms of their clinical team, we do have, we have great clinical staff here. I'm always amazed by the work that's done to just help equip our clients before they leave and step into a different level of care or back into the community with their aftercare planning and in some of their modalities that they use while clients are here. We have our master's level clinicians, which are our therapists. We have our care managers. We have CPRS staff, which again are such a support. CPRS staff are those that are also walking in recovery and have gone through the CPRS training. They have 2 years of sobriety time and that lived experience in recovery themselves. And that's just, I think that coupled with the clinical approach is just really, really empowering to women. We have our clinical associates, which work alongside both the clinical and the medical team as well. And so every client that's in an inpatient level of care, whether it's detox, residential, and then even these services are available in outpatient, they are going to have a therapist and a case manager assigned to them. And then we have on-site 12-step recovery meetings where meetings are brought in. Depending on the availability in the community, and things have been a little different because of just COVID restrictions and protocols, we were doing some off-site meetings because we are so close to 202 Friendship House, which is a clubhouse where they have different AA meetings several times a day and some other offsite meetings as well that they were attending. So they do have that opportunity to learn about what is 12-step recovery and walk through the first couple of steps while they're here with us. We do also have some offsite YMCA visits that we do so that they can do, Zumba or different dance classes, which they really, really like. And then some other treatment modalities, music therapy, like our Rock to Recovery program, which is where I love this program because they, from start to finish of their session, they write and record a song through their own words and through their own voices and through their own talents. And that's always just a beautiful group, and they enjoy that as well. And then we have some specialty groups around mindfulness and women's empowerment, pain and management, because that seems to be oftentimes, sometimes that was one of the reasons that someone started using opioids, for instance. Lots of education around trauma and relapse prevention, just because a lot of the women that we're serving have had trauma, have a high ACE scores, and then relapse prevention skills, of course, because they're going to be returning into the community. And so equipping them with some tools to understand what their triggers are and how to prevent that. So. And then we have a fabulous spiritual wellness coordinator. Her name is Tamby. I love Tamby and her approach and the way that she responds to each client and their individual needs, where they're at with their spirituality and with their walk with God or their higher power, or sometimes women have so much religious pain or trauma or abuse. So her approach, I feel like it's very individualized. And, we do have other opportunities for volunteers and for those in the community to be a part of either a prayer walk or prayer for the clients, where we can have clients who want to have prayer one-on-one. And it's just a really, it's allowing clients to meet them where they're at in their relationship with God and explore what that looks like. And sometimes that may be a fresh start, and sometimes that's no experience at all. And so it's a very unique approach of just walking alongside the individual needs of each woman in this way. And I always put this in here just because we were founded on, Christ-centered compassionate care, and it is the foundation of the next door. Faith is the foundation of the next door. And one of the things that we believe at the next door is that in order for true recovery and healing to happen, you have to address all of the areas of healing that are needed. And so that is not just the physical and emotional, which we're doing with, our medical model and with our clinical model, but also the spiritual recovery that's needed as well. And I mentioned before, a lot of the women that we're serving at the next door have trauma. And one of the things that they learn about here is how that affects, survival skills and what triggers that, and where some of their addiction may be rooted in that trauma. And so really shifting it away from shame reduction around a lot of the things that they've been experiencing, and saying, instead of what's wrong with you, what happened to you. That's something that if you are simply asking someone what their experience has been like and what their life has been like, and if you sit down and just listen to someone share their story, you can learn a lot and really understand a lot of the survival mechanisms that are no longer working for them, that they're holding on to. They just don't recognize that. And so it's really about teaching them how to understand how trauma plays into their addiction and how that is part of their recovery journey as well. And this is something I like to bring up because I work a lot with organizations or even faith-based settings around what addiction is versus what it isn't. And we believe that addiction is we believe in the, disease model of addiction, meaning that, say that someone is exposed to opioids for a certain amount of time, and throughout their time on opioids, anyone can become dependent. That doesn't mean that everyone becomes addicted, but really any exposure to something that changes the brain structure, repeated exposure and chronic exposure is going to change the reward pathways and different things within the brain that are going to require not just abstinence, but also recovery from some of the behaviors, and identifying what some of those behaviors are, so that they don't return to those learned ways of surviving and living. And so over time, the way that it changes the brain and the way that the brain needs healing, which, we've seen on MRI scans and all types of medical, support at this point. We're really trying to relay the message even to our clients that, it's not some sort of moral failing that you have, or it's not some sort of, willpower or lack thereof. You're not a bad person. It's not a moral issue. It's really, in order for you to recover, your brain needs time to heal. And there are some ways that we can help equip you, to help with that healing process sooner, along with some of the treatment modalities from the clinical perspective that are integrated as well. So this is just kind of my recap here. Again, addiction, it's not a moral failure. And we also, all of us really can help break the stigma that still exists around addiction just by talking about it, having conversation about it, providing education about what addiction is. Again, community is essential. It is why we are really, we really encourage aftercare involvement and alumni involvement, because you need that support. You recover together, not in isolation. When you're sharing your story with someone else, and when you're sharing your experience with someone else, it not only provides that human experience that you don't get when you isolate, but also it reduces shame. And again, we're really about shame reduction, because we see that that keeps women kind of trapped and enslaved in that addiction cycle. We have recovery support groups through our aftercare, but also encourage that in the community as well. And then also, addiction impacts the entire family. So if you're the loved one of someone who's struggling with addiction, there are also resources available in the community as well for you, because sometimes the clients that we serve are getting well, and the family also has their own journey of healing as well, so that the whole family can heal. So, and my last thing here, I love Brene Brown. I'm a big Brene Brown fan. And this is one of my favorite quotes from her, and it's about really shame reduction. But if we can share our story with someone who responds with empathy and understanding, shame can't survive. And we see that to be true when women recover together. So. Awesome. I did see a couple of questions pop up, but I didn't get to see them just yet.
Yes. Well, thank you so much, April. What amazing work that you guys are doing to assist women on their recovery journey. And I love that you ended with the Brene Brown quote. I also am a huge Brene Brown fan. I'm reading one of her books right now. She's so wise. So we do have a couple questions. Let's see. One is, do you currently have a wait list? Does someone need an appointment for evaluation?
So it depends. We don't have a wait list. What we do now, we do have a certain limited amount of grant space per month. So we're budgeted a certain amount of, we have a certain ability per month to help people who do not have insurance. So if we ever do have a wait list, it's in that space, only because there are, because of the great need in the community, we do fill those spots as soon as we can, and as quickly as we can, because the need is absolutely there. We have space right now in our outpatient setting, our inpatient detox res, all of our programming. And then in terms of how to get, make an appointment, you would just call in and do a phone assessment and get scheduled to come in for an in-person assessment. That's, we do have clients that walk in, and we're able to serve them sometimes, just depending on, we try to always help whenever we can. But yes, it is definitely encouraged to make a phone call, do an assessment, and then that way we can get you scheduled. It just helps with the experience and the process for the client as well.
Thank you. And then the next question is, how do you get most of your referrals? Do you have a relationship with the courts?
So I work a lot in the hospitals, again, just because of that acute level of care that we provide. We do work with some courts. So our reentry model in Chattanooga is a contract through the Tennessee Department of Corrections through the Chattanooga location. And so that is a separate program. And so sometimes I do get calls for people locally that are wanting to get people into that program from, a recovery court or someone that say is incarcerated, and they want their client to go into the longer term program. But that's really not the way that process works. It is strictly from women coming through the prison, and it's all contracted through the TDOC. So really the best way that we're able to help in a court setting, say that you have someone, and this could be even with Department of Children's Services, if that's part of a parenting plan, or if it's a parole officer that has someone who continues to relapse, is if they need the level of care that we provide, which is either detox or residential or outpatient, we can do an assessment and we can provide that. Sometimes that's recommended instead of time in jail. And so we have a letter that we can provide as well saying we've done the assessment. They're going to come in for outpatient for 6 weeks, or whatever the level of care that's been recommended is. And but I think because we existed for so long in Nashville doing reentry, which was a 6-month model, we still get a lot of referrals for that, for furloughs for clients that are wanting to come to our 6-month program here. And that program doesn't exist in Nashville anymore. And so yes, is the short answer. We can work with court systems, but I'm trying to make sure that they understand that it's in a shorter term capacity. It's in the more acute services. So it's not going to be a 6-month model. So if a judge is saying, I'm going to release this client to a 6-month program, then that would not be us. If they're saying, you've gotten a DUI, and before I send you to jail, I'm going to give you the opportunity for treatment, then that may be us. So it just depends on what they're mandating. Yeah.
Thank you. And April, you mentioned in your presentation the impact that this has on the families of the women that you serve. So could you talk to me a little bit more about that, about the impact of the Next Door on the families of your clients and then our community as a whole?
Yeah, I mean, it affects everyone we have a lot of women that come in who no longer have custody of their children. So we're working with their DCS caseworker, through parenting plan and trying to, get them involved in classes in the community that may look like inpatient and then step down to outpatient while we help, get you engaged with all the other parts of the parenting plan. It affects, the spouse of the person that's coming in, especially if there's been, there could be, sometimes there is financial, repercussions and DUIs, and people have lost their home, their job. It really it affects everyone differently, and everyone's bottom looks different by the time they reach us. Sometimes, it took one, one falling asleep at the wheel. I didn't get a DUI, but it scared me and I'm here. And then some, like, I've lost everything and now I'm homeless and now I'm here. So it really, I heard someone say once, your bottom is when you stop digging. And that's really true, because it does look so different for everyone. But if the family needs support, there are 12-step recovery support groups. And I think it's really important for family to understand that as bad as they may want recovery for their loved one, there's an element of willingness and motivation, and that has to come from the client, that they have to do the work. Because what we see a lot of times is a lot of codependency and a lot of unable to sort of separate and say, like, have some boundaries and detach with love and say, I need you to work on this and I'm going to work on myself. And that's just hard to do when you really, really love someone and you think that you're helping. And so sometimes it's education with the family on, like, what are those healthy boundaries? And so our therapist can identify a supportive person that can be involved. Again, the client has to have we have to have consent for that. But if the client is willing to work with, say, their spouse or their partner and come up with some, some ways that they can recover independently, but be healing, it's going to have a better outcome for sure.
Thank you. So I have one last question for you, and then we'll take any more questions that come through in the chat. So attendees, if you have any more questions for April, now's your time to put them in the chat. My last question is for you is about the pandemic. So we have all heard that the pandemic has increased rates of addiction and increased mental health problems. And then we know it's probably made your work tougher as well, keeping all of your clients safe. So my question is twofold. How has the pandemic affected your clients? Are you seeing an increase in issues with them? And then how have you pivoted your work to be safe around COVID?
Yeah, there's a lot there to unpack. Because at first, so when the pandemic first started, and there was just so much that we didn't know, we even reduced and went like one client to a room instead of having a roommate. Well, then that put a strain. You're decreasing beds during a time when people are having a lot of fear-based response to something that none of us knew what was happening. And so you've got increased mental health and substance abuse needs. We're all trying to figure out, some treatment centers completely closed down, some limited beds, some didn't change at all. So like everyone trying to just figure out how do we still serve clients, but keep everyone safe, keep staff safe. So we've shifted a lot and just tried to keep up with what was recommended through CDC and the guidelines and things like that, but also understanding, our mission is to help women in what is the more critical need right now, and what is going to basically what will kill them first, right? So if you are on the street and you are overdosing and your mental health, again, just because of everything, the way that the world was impacted, we tried to understand that need was actually increasing more. And so it has been a journey the last couple of years for sure, trying to help. And that's what we've tried to do. If we had, we did our best by screening clients, for certain questions before coming in. But what's interesting is that some of the COVID symptoms were very similar to withdrawal symptoms, specifically from opioids and things like that. So there was that struggle and that battle, because you don't want to create more barriers for clients when a need is higher in the community. So that's really been interesting. But we've really done the best that we can to continue to keep our doors open. We are back to 2 clients per room. And if a client does, have symptoms, we will get them tested. And thankfully, I feel like we've had protection over our women in our organization, a divine protection. Not to say that we haven't had some cases, but in comparison to some of the ways that other places have been impacted with, more outbreak type settings, I feel like we've really been protected in that way, and we've been able to keep our doors open and help women. So, but yeah, it is definitely one of the things that we did see was, when stimulus checks and things like that started coming out, a decline in people seeking treatment. Just the funds were there, I guess. And then like once that money went away, a rush of people wanting to come in. And then once another check hit, it was an exodus of people leaving. So it's just there've been a lot. It's a very complex question to answer, but I hope I did it well.
You did. Well, I'm so happy that you guys were able to keep your doors open and that you're now back to 2 clients per room, back at full capacity. That's great news. I'm sure that was very stressful.
Yeah.
throughout the past 2 years, but really happy that you guys are back in action. So
Yeah.
it doesn't look like we have any more questions in the chat, so I'll go ahead and close us out. For those of you on the call, I know you may have some further questions after today's presentation. So each attendee will receive a follow-up email with my contact information as well as April's contact
Mhm.
information from the next door. Please feel free to follow up with us for more information. Thank you again to April for taking the time to be with us today. I know I speak for all of us in this virtual space that we are so grateful for the work that you've done and the work that you continue to do. United Way is grateful to be your partner and a supporter of the Next Door's work. I also want to send a thank you to all of our attendees who joined us on today's call. Thank you for the time that you've donated to our community today and for your year-round support of United Way. This work could not happen without you. We hope that you'll join us again for our next tour Tuesday. Information for our next tour will be posted soon on United Way's Get Involved website page. So thanks again, everyone, and have a great rest of your week.
Thank you. Thank you for having us today. Thank you.
Bye.